What hormonal imbalance signs affect fertility and conception? Imagine trying to tune a delicate musical instrument and finding some strings out of tune. That's what hormonal imbalances can feel like when it comes to your fertility. Your body relies on a fine balance of hormones to regulate your menstrual cycle, ovulation, and the environment your uterus provides for a fertilized egg. When these hormones are off, it can cause signs that make conception more challenging. One common sign is irregular or missing periods. If your cycle is unpredictable or you skip periods altogether, it might mean you're not ovulating regularly. Without ovulation, there's no egg available for fertilization, which makes conception unlikely. Spotting or bleeding between periods can also be a sign of hormonal disruption. This bleeding might happen because the uterine lining isn't developing properly, which can interfere with implantation if fertilization occurs. Heavy or painful periods are another clue. Excessive bleeding or severe cramps can be linked to hormonal imbalances affecting your uterine environment. Sudden or unexplained weight changes can also point to hormonal issues. For example, thyroid problems or polycystic ovary syndrome can cause weight gain or loss and impact your fertility. Noticeable changes in hair growth or hair loss are signs too. Excess facial or body hair, known as hirsutism, and male pattern hair loss often indicate elevated androgen hormones, common in polycystic ovary syndrome. These hormonal shifts can disrupt ovulation and reduce your chances of conceiving. Mood swings and skin issues like acne are also common signs of hormonal fluctuations that can affect fertility. Men are not left out. Low sperm count, erectile dysfunction, breast tenderness, or male pattern hair loss can all be signs of hormonal imbalances involving testosterone and other reproductive hormones, which can impact fertility. Hormonal imbalances interfere with fertility in several ways. They can cause ovulatory dysfunction, where hormones like follicle-stimulating hormone, luteinizing hormone, estrogen, and progesterone don't work together properly. This can delay or stop ovulation altogether. If your luteal phase, the time between ovulation and your period, is too short, your uterine lining might not be ready for an embryo to implant, leading to early pregnancy loss or difficulty conceiving. Thyroid hormone problems, whether too little or too much, can throw off your cycle and ovulation. And polycystic ovary syndrome, which involves excess androgens and irregular periods, is a leading cause of infertility. To support your fertility and preconception health, maintaining a healthy weight through balanced eating and regular exercise is key. Managing stress is also important because high stress levels can disrupt hormone production and menstrual cycles. Tracking your cycle and symptoms can help you spot signs of imbalance early. This way, you can consult healthcare providers or fertility specialists sooner. Focusing on fitness routines that improve insulin sensitivity and hormonal regulation can be especially helpful if you have conditions like polycystic ovary syndrome. When you understand these signs and how hormonal imbalances impact your fertility, you can take proactive steps to prepare your body for conception. This approach can boost your chances of a healthy pregnancy and a joyful journey to motherhood.